She's just in the, okay. Good afternoon. The subcommittee will come to order this afternoon. We are marking up three bills, H.R. 1792 with an amendment in the nature of a substitute, H.R. 1490 with an amendment in the nature of a substitute, and H.R. 1804 with an amendment in the nature of a substitute. I support these bills, and I encourage all of my colleagues here today to support them as well. In accordance with committee rules, staff has received cost estimates from the Congressional Budget Office on each of the measures. We will need to identify some offsets before the bills are reported out of the full committee, and I look forward to working with the minority to find offsets. To summarize, the amendment in the nature of a substitute to my bill, H.R. 1792, the Infectious Disease Reporting Act, would allow the VA Secretary to take administrative action against what's the acronym? VISN, okay, director who fails to comply with the reporting requirements. It would be also subject to VA to other remedial action that a state may take for noncompliance of infectious disease reporting. It narrows the reporting requirement to the accrediting organization to only healthcare associated infectious centennial events which are an unexpected occurrence involving death or serious physical or psychological injury or the risk thereof. And it would also require that the House and Senate committees on Veterans Affairs be notified every time a VA facility reports an infectious disease. It also includes the technical changes of replacing the phrase infectious disease occurring at a VA facility to an infectious disease diagnosed at a VA facility, and clarifying the definition of infectious disease to bring it into alignment with the definition used by the states. The amendment in the nature of a substitute to Chairman Miller's H.R. 1490, the Veterans Privacy Act, would allow the Secretary to waive the requirement for informed consent if a physician or psychologist determined a recording was necessary for patient safety. It would also clarify the definition of physical recording to exclude medical imaging such as MRIs and images and video for telehealth and telemedicine, a request made by VA. Finally, the amendment in nature of substitute to Representative Holscamp's bill, H.R. 1804, the Foreign Travel Accountability Act, would put a 60-day deadline following the 180-day reporting period for VA to report to Congress. It would add promotional items and registration fees to the list of items to be reported, and it would expand the reporting requirements to include domestic and foreign travel paid for by non-federal sources. At this time, I'd like to recognize the ranking member for any opening remarks she would like to make.
Thank you, Mr. Chairman. Today we have three bills before us that address some of the unique needs of our nation's veterans population. These are good bills seeking to guarantee privacy protection, protect public health, and ensure fiscal accountability at the Department of Veterans Affairs. The three bills on today's agenda, including one of your proposals, Mr. Chairman, address shortfalls in current VA law and provide common sense solutions. The first bill, H.R. 1490, Veterans Privacy Act, introduced by Chairman Miller, ensures that any visual recording made of a patient in VA care be done with the express permission of that veteran. Drafted as a result of the experience of one family in Tampa, Florida, uneasy about the privacy of their loved one in a VA facility there, this bill will lay out concrete repercussions for privacy infringement in any VA facility in the country in the future. H.R. 1792, Infectious Disease Reporting Act, sponsored again by you, Mr. Chairman, would require the VA to report any incidents of infectious disease in medical facilities to the appropriate state agency. This bill seeks to address a critical issue that we do not take lightly. The importance of the immediate reporting that this bill requires can be seen in the Legionella outbreak that sickened 21 people, killing 5. Allegedly, the Legionella bacteria was discovered in the water systems as far back as 2007, 5 years before the agency disclosed it. Under the provisions of this bill, in the future, the VA cannot be slow to react to a potential risk to the surrounding community. The proper authorities must be notified and resources employed immediately upon diagnosis. While I support the reporting requirements, Mr. Chairman, I have some concerns about using state fines as an enforcement mechanism. H.R. 1804, the Foreign Travel Accountability Act, introduced by Mr. Hulskamp of Kansas, would direct the Secretary of Veterans Affairs to provide regular reports to Congress of the foreign travel made by VA employees on official business. Though I have no trouble understanding the need for some foreign travel in order for the department to fulfill its responsibilities, to best serve veterans and maintain memorials to their sacrifices, requiring these reports will help ensure we are doing our due diligence to see that taxpayers' money is well spent in the process. I would like to thank the majority for their collaboration on improving the legislation we are marking up today. I appreciate their hard work and willingness to work together, and I hope we can continue moving forward in this manner. Thank you, and I yield back.
Thank you, Ranking Member Kirkpatrick. I now call up H.R. 1792. The clerk shall report.
H.R. 1792, to amend Title 38 United States Code to direct the Secretary of Veterans Affairs to report cases of reportable infectious diseases at medical facilities of the Department of Veterans Affairs in accordance with the state law.
The bill was circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with. The bill is now open for amendment at any point. I have an amendment in the nature of a substitute at the desk. The clerk shall report.
Amendment in the nature of a substitute to H.R. 1792, offered by Mr. Kaufman of Colorado.
I ask unanimous consent that further reading of the amendment in the nature of a substitute to H.R. 1792 be dispensed with. Hearing no objection, so ordered. As I said earlier, my amendment incorporates changes that would bring the reporting requirements more in line with what is currently in place with the states and allow for non-monetary remedial action to help bring VA into compliance with infectious disease reporting requirements. Is there any more discussion on the amendment in the nature of a substitute? Yes.
Mr. O'Rourke. Amendment to the amendment in the nature of a substitute.
Clerk shall report.
An amendment to the amendment in the nature of a substitute to H.R. 1792, offered by Mr. O'Rourke of Texas.
I now recognize Mr. O'Rourke in support of his amendment to the amendment in the nature of a substitute for 5 minutes.
Thank you, Mr. Chairman. And first, I want to commend you for offering this legislation, this bill. I support the bill and I support its intent. What happened in Pittsburgh, as the ranking member said, can never be allowed to happen again. And I think the increased reporting requirements contained within this bill will help us to achieve that very necessary goal. But I do want to make sure that we are keeping our focus on improving healthcare and outcomes and assisting the VA in achieving these goals. I think that the separate requirements state by state, 50 different states, specifically when it comes to the punishment for infractions incurred under this bill, will create a lot of additional work, a lot of additional it will divert capacity and resources from where we want those resources placed. And I think it also sets a troubling precedent where we cede our oversight authority and our jurisdiction to the individual states. I think we've been entrusted by the voters in our districts to oversee the conduct of the VA and to ensure that outbreaks like these do not happen again. And I think the reporting requirements contained within your bill are sufficient to do that. If we find that the VA is not performing to the level that we expect it to and it's not protecting the health of the veterans whose care is entrusted to it, I think we have recourse within our jurisdiction to improve the VA and to hold those who have failed accountable. And so I very respectfully ask that the other members of this committee support this amendment to the amendment in the nature of a substitute. And I yield back.
Thank you, Mr. O'Rourke. Is there anyone who would like to speak in opposition to the amendment in the nature of a substitute? I now yield myself 5 minutes. I appreciate the concerns that Mr. O'Rourke brings up in his amendment to the amendment in the nature of a substitute. Section 3 is modeled after the Federal Facilities Compliance Act passed in 1992 on a bipartisan basis. That law allowed states to fine federal facilities that were not in compliance with state environmental laws. Here, the states are not imposing a fine, but rather VA is now required to pay as a civil penalty an amount equal to the fine that would be collected in state court. If VA fails to pay the penalty, the state may pursue collection in federal court, not state court. Is there any more discussion on the amendment to the amendment and the nature of a substitute? The question now, is there any more? Yes. Dr. Rowe.
As I understand the amendment, it would be to not require the VA to undergo state reporting requirements in each state because of the VA being in probably most of the states. Is that what the just the complexity of it?
Mr. O'Rourke.
No.
I'll yield to you.
And I thank the gentleman for yielding. The reporting requirements remain intact. It is the fines and the punishments that are contained state by state that would remain. And I'll give you a few quick examples, Congressman Rowe. For example, Minnesota has no fines in their state law, while Texas classifies violations as a Class B misdemeanor that includes fine and jail time. In California, each day of the violation is contained as a separate offense. It carries a fine of up to $1,000 and 90 days in jail. Therefore, a delay of 10 days could be $10,000 and 900 days in jail for someone. So sorting out who serves that time, how we comply state by state, again, I think takes resources away from where we want them focused. And I yield back.
Okay. Thanks, the gentleman, for yielding. I would say that probably HCA Corporation, which is a for-profit hospital corporation, has 199,000 employees in 20 states across the country, and they comply in each state. I yield back.
Any other comments? The question now occurs on the amendment to the amendment in the nature of a substitute. All those in favor say aye. Aye. All opposed say no. No. The noes have it. The question now occurs on the amendment in the nature of a substitute to H.R. 1792. All those in favor say aye. Aye. All opposed say no. In the opinion of the chair, the ayes have it. Is there any more discussion on the bill as amended? Hearing none, the question now occurs on the bill of H.R. 1799 as amended. All those in favor say aye. Aye. All those opposed say no. In the opinion of the chair, the ayes have it. I now recognize Congressman Lamborn for a motion.
Mr. Chairman, I move that we favorably report H.R. 1792 as amended to the full committee.
There is a motion to favorably forward the bill as amended. All those in favor say aye. 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 All those opposed, no. In the opinion of the chair, the ayes have it, and H.R. 1792 as amended is favorably forwarded to the full committee. I now call up H.R. 1490. The clerk shall report.
H.R. 1490, to amend Title 38 United States Code to prohibit the recording of a patient in a facility of the Department of Veterans Affairs without the informed consent of the patient.
The bill was circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with. The bill is now open for amendment at any point. I have an amendment in the nature of a substitute at the desk. The clerk shall report.
Amendment in the nature of a substitute to H.R. 1490 offered by Mr. Kaufman of Colorado.
I ask unanimous consent that further reading of the amendment in the nature of a substitute to H.R. 1490 be dispensed with. Hearing no objection, so ordered. As I stated earlier, my amendment in the nature of a substitute narrows the definition of a visual recording to not include medical imaging and images and video for telemedicine. It also allows for VA to waive the requirement for patient consent if a physician or a psychologist deems the recording necessary for patient safety, Is there any more discussion on the amendment in the nature of a substitute to H.R. 1490? Since no other amendments were timely filed, the question now occurs on the amendment in the nature of a substitute to H.R. 1490. All those in favor say aye.
Aye.
Aye. All those opposed, no. In the opinion of the chair, the ayes have it. Is there any more discussion on the bill as amended? The question now occurs on Bill H.R. 1490 as amended. All those in favor say aye. Aye. All those opposed, no. In the opinion of the chair, the ayes have it. I now recognize Ranking Member Kirkpatrick for a motion.
Mr. Chairman, I move that H.R. 1490 be favorably reported to the full committee as amended.
There's a motion to favorably forward the bill as amended. All those in favor say aye. All those opposed, no. In the opinion of the chair, the ayes have it, and H.R. 1490 as amended is favorably forwarded to the full committee. I now call up H.R. 1804. The clerk shall report.
H.R. 1804, to amend Title 38 United States Code to direct the Secretary of Veterans Affairs to submit to Congress semi-annual reports on the cost of foreign travel made by employees of the Department of Veterans Affairs.
The bill was circulated in advance pursuant to committee rules without objection. The first reading is dispensed with. The bill is now open for amendment at any point. Mr. Hulskamp.
Yes, Mr. Chairman, I have an amendment in the nature of a substitute for H.R. 1804.
The clerk shall report.
Amendment in the nature of a substitute
Mr.
to
Chairman, I ask unanimous consent for further reading of the amendment in nature of a substitute to H.R. 1804 be dispensed with.
Hearing no objection, so ordered. I now recognize Mr. Hulskamp in support of his amendment.
Thank you, Mr. Chairman. I appreciate the opportunity to visit with you all in the committee about H.R. 1804. I appreciate the feedback we received from both the VA and various VSOs during last week's hearing. In response to their testimony, we made a few modifications to the bill text, and that's reflected in my amendment in the nature of a substitute. This legislation directs the Secretary of VA to submit to our committee and the Senate Veterans Affairs Committee a semi-annual report with detailed accounting for covered travel made during a 180-day period. Covered travel is defined under this act to include travel paid for by the department or other elements of the federal government to a location outside of the U.S. Additionally, the travel reporting provisions in the bill in the substitute have been expanded to include domestic and foreign travel paid for by non-federal sources. As I testified last week, the bill would require the outlining of specific travel-related costs to be included in the report shared with House and Senate VA committees. I believe this is a simple and reasonable request to make to the VA. Disclosing costly foreign travel as well as privately sponsored travel adds a layer of accountability to how VA employees are not only spending their time but also taxpayer dollars. I believe sharing this information is necessary to conduct good congressional oversight of taxpayer dollars. So thank you once again, Mr. Chairman, for the opportunity to share with you about H.R. 1804. I yield back.
Thank you, Dr. Hulskamp. Is there any more discussion on the amendment in the nature?
Mr. Chairman, I just asked Mr. Hulskamp, do members of Congress have to disclose all that for all foreign travel?
I believe we have to, particularly the privately sponsored travel, and I haven't taken any foreign travel, Mr. Chairman, and I haven't had to report that currently.
So it's the same reporting requirements that we go through?
I believe it's
I yield back. Thank you.
Thank you.
Is there any more discussion on the amendment in nature of a substitute to H.R. 1804? Since no other amendments were timely filed, the question now occurs on the amendment in the nature of a substitute to H.R. 1804. All those in favor say aye. Aye. All those opposed, no. In the opinion of chairs, the ayes have it. Is there any more discussion on the bill as amended? Hearing none, the question now occurs on the bill H.R. 1804 as amended. All those in favor say aye. Aye. All those opposed, no. In the opinion of the chair, the ayes have it. I now recognize Ranking Member Kirkpatrick for a motion.
Mr. Chairman, I move that the bill H.R. 1802 be favorably forwarded to the full committee as amended. I'm sorry, 1804.
There's a motion to favorably forward the bill. All those in favor say aye. All those opposed, no. In the opinion of the chair, the ayes have it, and H.R. 1804 as amended is favorably forwarded to the full committee. I ask unanimous consent that the committee staff be authorized to make technical, clerical, and conforming changes to the bills favorably forwarded today. Hearing no objection, so ordered. I thank the members for their attendance today. and the subcommittee is adjourned.
Thank you.